Hi, and welcome to an ABCT webinar to help you all get comfortable in doing telemental health or meeting with your clients from a distance. I'm Kate Morrison. I am a psychologist in Salt Lake City, Utah, where I am part of I run a private practice that is entirely based in telemental health. So today I wanted to give you as much of an overview as possible of what you might be having some questions about right now as you're all shifting over to doing Telly if you've never done that before. I don't know everything, but I'm going to do my best to share with you what I've learned along the way. I've been doing this for a while and have learned quite a bit through the process. So let's first just get started with one of the big questions that people have. It's regarding licensure and the laws. First thing to be paying attention to is that you do need to be licensed in the location that your client is in during the session. So this may be lifted during emergency situations and is the case for some states already and some areas already. And I've attached a link here that talks about or where ASPPB has brought together some of that information about states that are allowing interjurisdictional practice because it's an emergency situation. So you can follow that link there to learn more about the specifics of your location and your profession. You do want to be aware of the regulations of your region and your profession. These differ, but if you're in doubt, I always recommend just contacting the relevant licensing boards. And this would be for the ones that your client will be located in during the session. So it doesn't matter where they're a resident, where they normally live, it's where they're at the time of the session. I've also found that state and region specific associations often have a lot of tele resources that can be really helpful, that can give you more information about the specific area that you're in. So I'm going to walk you through steps kind of in the chronological order of what you'll be doing before, during, and after seeing a client via tele. So first, let's talk about some things that you need to have set up before you see your client. First thing is that you need the appropriate supplies and devices to be able to do that. And this is both for you and your client or clients. On each end, you're going to need a private space during the session. So where you're not going to be disrupted and they're not going to be disrupted, where sound can't be heard either direction from that space. You'll need an electronic device that has a camera, speakers, and a microphone, and that can connect to the internet. You can use a headset, like for example, I have a headset that I will use sometimes when seeing clients, partially because it blocks the sound from if my spouse is in the house and I don't want them hearing what's happening in the session, so it blocks the sound that way if I just have the headset on. But it also has a noise canceling microphone, which I find to be really nice in case my dogs are making noise or there's construction outside. So that can be really helpful, but it's not necessary. If your device has speaker and microphone, you're good to go. Regarding internet connection, I recommend having an Ethernet cord that's directly connected to your modem because it's going to be stronger and a more reliable connection than if you're meeting through Wi-Fi, and that's the same on your client's end. But that's in a perfect world. We don't live in a perfect world, and so I recommend Wi-Fi if you've got that. One nice thing, and I put a link here, is where you can test your internet speed, and some of the video platforms that you'll use, they will ask you, or they'll recommend a certain speed of internet, and you can get a sense of where yours is at, and if you might need to make some adjustments there. You're also going to need a video conferencing platform. Now, typically, you are going to need a HIPAA compliant platform with a BAA to make it fully compliant. During this time, because we are in emergency situations, and this is just kind of a unique circumstance, HIPAA has paused that requirement at this time. So what that means for you is that you can use platforms. So the way that you're connecting with someone, you can use platforms like FaceTime or the free version of Skype, but normally that is not allowed because those are not HIPAA compliant. I recommend that if you can have access to a HIPAA compliant platform to do so, just because the pause in HIPAA requirements is not going to last forever. There's a couple of places that you can find these. Some EMR systems have them built in already, so like Simple Practice or Theranest, and I know others do as well. That's just part of their system, so you can just use that. And then there are separate platforms like VC or Doxy or Zoom or Skype for Business. There are HIPAA compliant or have HIPAA compliant versions. But again, you don't need to have that right now just because of our unique situation. Continuing on with before you see your client, you're going to want to have the location that you're in set up to do therapy. I recommend reducing as many distractions as possible. So kids, pets, doorbell ringing, notifications on your phone or on your computer, have that all turned off. I have a sign on the front door of my home that just says, please don't knock or ring the doorbell. I work from home and in video calls, so people know not to disturb me. You can also put a sign on the outside of like your office door that shows whether you're in session or out of session. I also have a white noise machine that I have outside my office door to just reduce sound that can travel either direction. So things that you would be doing if you were in an office elsewhere, but you just have to kind of think through how that's going to look if you're working from your home. It's good to have a simple and professional background behind you. I put a picture there of what my background looks like when I'm not sitting in it, but you can also see it here. It's going to be what's seen behind you during your calls. So I just recommend it being something that you're okay with your clients seeing. You want to make sure that your lighting is coming from behind your camera facing toward you because it will light up your face regardless, like if you're in a room with windows, regardless of what the sun is doing at the time, it's going to keep your face lit up so clients can see you. And I help clients figure this out for themselves as well. Because for example, if you have a window behind you and the sun is coming through, you're not going to be able to see their face. They're not going to be able to see your face. And so it just makes it harder to read someone when you can't see your face. So make sure that that's all adjusted as needed and try to sort that out on your end prior to the session. You want to set up your camera so it's eye level with you. So right now I am using my laptop and the camera is built in with that. And I just have it propped up so it is at eye level with me. You can do that. You can adjust your chair, adjust your desk, kind of do what is needed. But it just is a more natural looking format if it's eye level with you rather than looking down at your clients or looking up. It just is a more pleasing format. Then you also want to position yourself a couple of feet away from the camera. You want to be close enough that you can see facial expressions, but not so close that it's unnerving that you're like, right in your client's face. So keep yourself a little further away from the camera than you might realize. You're also going to want to have a telehealth specific informed consent. I've put a link here to an example that I found to be pretty useful. One thing that I add to my informed consent that I don't often see in them is related to expectations for in-session behavior. Generally, what I tell my clients is I want you to treat these sessions as if you were in my office. So don't show up in your boxers smoking a joint. We're not going to hold the session if that's what you're going to be doing, because you also would not do that in my office. And if these if these behaviors occur, I'll end the call. You can call me back when you are ready to hold the session. And so that's understood ahead of time. I highly recommend doing this at the very beginning of meeting with people, because it's likely something like this will come up, or people are driving during their sessions, or trying to cook a meal or do laundry during their sessions, or just something where you are not getting their full attention. So just have an agreement ahead of time of what you're okay with there. Have a plan if the call gets disconnected. Make sure you have a phone number for them, or they have that they have a phone number for you. So if any technological issues come up, which I guarantee something will come up at some point, you're going to be able to still continue to have that session and finish it via phone. Or if your audio goes out, you can mute your microphone and mute your speaker, but keep video going, but then call them on their phone. So then you can have that to still keep the session going if you do have some technology issues. You want to be prepared for emergency situations. What you want to do is have information of the local kind of local contacts for that person if it's different than the location that you are in at the time that you're calling. So local crisis numbers, hospitals, police, abuse reporting, you want to know what those are for the location that the client is in. If you call emergency services, they're going to go to your local area, but they can transfer you to that client's local area. So you can call and say, I have a situation where I need you to go check in on this person at this location, and that they can help you sort that out. But it's still nice to have those local resources in case that doesn't work. Ahead of time, it'd be good to prep worksheets, measures, and handouts that you use often with your clients to have them in digital formats so you can share those easily with your clients. All right, so once you're actually in the session with someone, the very first thing that you want to do is get their location for that day. There's two reasons for that. One is that if you have to send emergency services to them, you need to know where they are located. So you want them to give their location to be specific enough to where if you were to describe to someone where to find them, you would be able to do so. So if they're sitting in their car in a parking lot at their work, you're going to want to get either like their license plate or the type of car that they're in and like a general sense of where they're at in the parking lot. You don't just want the address because that's not going to be very helpful to you. You also want this information to make sure that they're located in the spot where you are licensed to see them. So if somebody gets on the phone and they say, oh, I happen to drive to Arizona today, and I say, oh, well, I'm not licensed in Arizona, so we're not going to be able to hold our session for today. You can check in and make sure that there's no urgent needs or any sort of crisis or emergency situations. And then you can end the call for that day and make sure that you get set up to see them when they're back in the state that you are, or the area that you're licensed in. Because if I were to continue with that session, I technically would be practicing without a license. Some people have some concerns about meeting through Telly because they have concerns about what it does to rapport. So I'm going to just walk through some tips that I have about trying to build or maintain this when you're meeting with people through Telly. I find that you just need to be much more intentional about it. The biggest thing I can recommend is to place the video or the frame where you see the person's face on your screen, move it on your screen to where it's next to where your camera is at. So when you are looking at the face of your client, it is going to direct your eyes to the camera on your end. And so on their end, they're going to see it as you looking at them, rather than if you're looking down and you're still looking at their face, to them, it looks like you're looking away from them. This makes a world of difference in having it feel like you're actually in the room with the person. Take some extra time to say hello and goodbye at the beginning and the end of your sessions, and doing that small talk that you would normally do going to and from your therapy room. You don't get the opportunity to do this when you just all of a sudden are in the session and out of the session. And it can break down that time that you have to get to chat with the person. So ease into the session and ease out of it a little more than you might normally do. If you're doing anything that is outside of the sight of the camera, let them know what you're doing. So for example, if I'm taking notes, it would look like this. And you don't see what I'm doing, and that might feel a little weird on the end, on the other end, if no one knows what's happening there. So I say, okay, I'm just going to take a couple of notes about what we're discussing today, and then I would write that down. Or if there's like a loud sound outside and you look out, let them know like, oh, there was just something loud outside. Sorry, that caught my attention. Try to make it feel like they're in the room with you as much as possible. Because if you suddenly look up at something, it might be like, oh, did somebody just walk in the room? What just happened? And that can just feel distancing. Like I said, strong communication is extremely important. Video delays can impact that. So I address this right at the beginning of therapy with people. I say, you know, I am never intentionally a jerk. If I laugh at something when you are saying something that's really sad, it's likely because there was a delay and I maybe missed something. So if that happens, just tell me and say, hey, Kate, I don't know that you fully heard that thing that I just said, here's what I said, and then let us repair from that. So I just lay that out there completely with people at the very beginning. Don't make a big deal out of tech issues. They're gonna come up, things are gonna get disrupted. Just get reconnected and jump back in. You've already had some of your session time wasted from that disruption in the technology. Don't waste more time by apologizing or expressing your frustration or annoyance with what's going on. Just get back into it and get running as soon as you can. I find if you just say to the person, hey, we just got disconnected, the last thing I heard you say was, and then just go from there. So actually doing therapy in Telly sessions, I do a lot of exposure work, and I really enjoy meeting with people in their homes because I actually get to do exposure practices with them in their home and in the environment that these things are happening. So I actually find this as a really big advantage, especially for exposure therapies, but things like hoarding as well. I also do a lot of work with trichotillomania. So if I have someone that says, I'm doing really good everywhere else, I'm not pulling my hair, but this one spot that I keep getting stuck in is when I'm laying on my couch, reading a book, and I keep pulling in that situation. Then I can say, great, let's take the camera over. I want you to go hang out on your couch and read your book, and let's do some awareness training in that exact situation where it's happening rather than talking about it and sending them home with practice for that. So I actually really prefer doing Telly for these types of treatments when I can actually be in the environment that some of these exposures need to occur. When you do this, just make sure that they have the camera set up so you can see the full practice that's happening, or as much of the practice as possible, because you want to make sure that you're keeping an eye out for all those kind of subtle avoidance behaviors that could be occurring, and make sure that you see the whole situation. So just have them set that up in a way that you can do that. I also do a lot of ACT, which is a very experiential therapy, and I find myself needing to make adjustments to some of the exercises or metaphors I would have done in person. And so I find myself doing more imaginal or just adjusting those in-person practices. So example, like a tug of war exercise, it's a common exercise used in ACT. I can't hold on to a rope on this end and do that with someone on the other end. We could pretend, but it doesn't quite have the same effect. So I might replace that with something like having someone hold an object away from their body and saying, what is it like to try to keep this object away from you, and focus on like the sensations that they're having in their arm and how that's different than holding it in their lap. And so you can get the same concepts across, you just kind of have to be creative about how you're going about that when you can't actually do some of those in-person exercises. Another thing that people, I think, often struggle with the transition over to Telly is having not having a whiteboard always, and not being able to fill out worksheets via paper in the session. So you can see I have a whiteboard here behind me. I use a thick, dark marker on that, and it works pretty well, but not everyone's able to see that, especially if they're using a phone or a tablet. It's a lot smaller, and so it's really hard for them to see. So the other things that you can do, you can actually get a small portable whiteboard, and then you can write on it and then hold it up to the screen so then it can be seen much closer, and that works pretty well, or even just on a piece of paper, you can do that. A way to also get around this is to have fillable PDFs that you can then share on your screen, and you can just type in it and walk through that with the client as it's happening. The same goes for like Microsoft Word or Excel or whatever other program that would be helpful, that you can use that as a way to do what you would have normally done on paper or in person. One, I think it might be Skype for Business, don't quote me on that, that they actually have, like, and I think Zoom does as well, they have an actual whiteboard feature within the platform. So not all platforms work well for this. So if this is a really important thing for you in doing your therapy, I'd want to make sure that you, when you're deciding which ones to use, that they have screen sharing or they have that whiteboard feature. Also, really make sure that if you are sharing your screen with your client, make sure you don't have any protected health information up and that your notifications are off so they're not seeing anything that they should not be seeing. And then for clients to share information back with you, like their completed measures or their homework, I found that either if it's brief, that they can just do this verbally with you, they can report like behavior tracking to you, or they can share worksheets through their EMR or through email if you've gotten an agreement from them to do that, and that they understand the risks with using email. Or they can share their screen and then you can take notes on your end. And then when you are done with the session, you need to bill this as a telehealth session. The way that you go about doing that is adding a modifier to your CPT code. And the modifier you want to use for synchronous telemedicine, which just means real-time video conferencing, is 95. GT was used in the past, and I think some systems still use that. So check with the system that you're billing through to see what they would like. I think for the most part, it is going to be 95. And so, for example, a 90834 is 9083495. And then your place of service code is going to be 2, which is for telehealth. And then at the end, you're going to want to add to your documentation that this client was seen via Telly or video conferencing, however you'd like to word it. I put the examples at the end of the slides, or the ones that I use that I adapted from the Seattle Telly team that I worked for there. At the VA. And so feel free to copy and paste and use that as you wish, but I just put that as a header on my notes. And I have one for the first time that they do Telly and then all subsequent sessions. Some special considerations or things that you will want to be thinking about is if you work with children and adolescents, this is my personal recommendation, is to make sure that there is a parent or guardian present in the home during the appointment. I've had situations in working with kids and adolescents via Telly where I've been very happy that there was an adult in the home. So this could be different. Like if an adolescent would have normally driven to your office, I still would maybe recommend having an adult in the home during these sessions, but that is up to you. If you are working with people who have delusions or hallucinations related to technology, Telly might not be a good fit. And I know that you may not have an option to see them in a different format right now, but you might want to consider if maybe talking with them over the phone would be better if they have less concerns about that. Just know that this can be difficult for people with those specific beliefs to engage in therapy in a meaningful way when they have concerns about being recorded or that someone's listening in related to technology. If you're doing groups, so doing groups via Tele could be a whole nother presentation on its own. What I just want to say about this is that not all of those video conferencing platforms allow multiple people to be in a call at one time. So if you do need groups, make sure you're figuring out what platforms would be best for that before you get signed up for one or before you start using it. As far as the actual running a group via Tele, if you have colleagues in the VA, I really recommend chatting with them about it. They've either been doing this for a while or are definitely doing it now. So I would touch base with some VA colleagues because they're the group that I know the most that has done a lot of work in groups via Tele. And then lastly, I want you to just make sure that you're paying attention to your health while you're doing this. I recommend moving around in between your sessions. Give your eyes and your body a break from sitting in this position all day long. You're going to want to be more purposeful about connecting with your colleagues as well, because you're not going to run into them in the hallway or in the break room. So you might want to make sure that you're scheduling this in or getting that kind of informal consultation that you would have otherwise. And then please reach out for consultation as needed. This is new and stressful for a lot of people right now. I know you are not alone in it if you're feeling that way. So please don't hesitate to reach out and to get help. And if you don't have people in your life, in your lives that can offer that help for you, my email is at the beginning of this talk, and I'd be happy to be a resource for you as well. I take value in helping people get more comfortable with this platform. So please let me know if I can be of any help to you. I've added some resources here that you might want to look into to dive into any of these topics more. There's a lot of free and highly discounted trainings available right now that are much more in depth in this, but I really wanted this to just be a quick overview of the things that you need to get going. And here are those notes that I mentioned at the end. Feel free to cut and paste as you'd like. And I just want to say thanks to ADCT for putting this together. And I've really been quite proud of our profession and the groups that I'm a part of to see how much people are coming together to help one another right now. So I hope this was of help to you. Again, please let me know if you have any questions. I'd be happy to be in additional support. And I wish you all the best in how you are going about your new telehealth journey, and hope you all stay well right now. Thank you.